Welcome back to the second day of the 2021 World Cancer Leaders Summit. I'm Hannah Vaughan-Jones, and it's my great pleasure to be your host for this exceptional 2021 edition, which for the first time has been taking place virtually. Now, yesterday we had some great conversations with speakers from across the globe addressing this year's summit's theme. That's driving innovation to advance cancer control equitably. So far, we've had over 600 connections on this platform from nearly 100 countries, and all sessions broadcast yesterday and today, of course, will be available for up to 3 months on demand on the Summit platform. That's in the digital library. And the platform itself will enable you to follow the event live, as we hope you're doing now, and watch content on demand as well. You can ask questions to all the speakers, chat to other invited leaders, and also connect with them one-on-one as well, and view each other's profiles, as well as, of course, as the profiles of the partners and sponsors. Now, if you experience any technical challenges, we urge you please to use the help desk, and we also encourage you to join in the online conversation on social media with @UICC and @ASCP_Chicago on Twitter, and by using the official hashtag 2021WCLS. Once again, today we will be welcoming our summit performer, the incredible Baba Brinkman, who will give us 2 more live interactive sessions with his fantastic rap, which I will not try to emulate at any point. But to get us started today, we are going to go over to Boston, where, of course, the summit was due to actually take place in person. We're connecting there with the summit host, the American Society for Clinical Pathology, and their president, Dr. Sanford, their president-elect, Dr. Rinder, and their CEO, Blair Holliday. ASCP are hosting their annual meeting in Boston as of tomorrow, I understand. So very good morning to you all in Boston.
Good morning. Thank you so much for having us. As you've already mentioned, I'm Dr. Kimberly Sanford. I'm president of ASCP, and we are so happy to join you all, at least virtually, from Boston. And we just wanted to say good morning or good afternoon in some of your locations, and to just say how much that we look forward to meeting with you all in the future. Thank you.
It's wonderful to see you all.
I'm Henry Rinder. I'm the president-elect of ASCP. So until Friday, I listen to everything Dr. Sanford says. And after Friday, I listen even harder to everything Dr. Sanford says.
And I'm Dr. Blair Holliday. I'm the CEO of ASCP. And the relationship with the Union for International Cancer Control and ASCP continues to be stronger and stronger as we provide access to diagnostics and therapeutics across the world. Again, congratulations on a very successful meeting, and thanks for all you've done to support our relationship.
Well, as I said, it's great to see you all. It sounds like you're all on message, president-elect to president as well. So congratulations on that. And we look forward to connecting with you throughout the course of today, and wish you well as well with the annual meeting, which kicks off tomorrow, I understand. Thanks so much. Wonderful to see you all in Boston. Now, to formally open our second summit day, we will hear from the Director General of the International Atomic Energy Agency, Rafael Mariano Grossi. Now, the agency itself is based in Vienna and is one of the 3 summit UN partners alongside the World Health Organization and the International Agency for Research on Cancer. Today, Rafael Mariano Grossi will talk to us about improving access to cancer care through innovation at the IAEA.
Ladies and gentlemen, while the world has been focused on COVID-19, the global cancer crisis has worsened, and it will get worse. By 2040, there will be more than 30 million new cases burdening lives, communities, and entire health systems. Poorer countries will bear the greatest burden, as always. They cannot carry it alone, and the International Atomic Energy Agency is determined to see to it that they do not have to. The IAEA has 6 decades of experience working in cancer. We educate and train radiation medicine professionals. We offer technical advice. We procure equipment for diagnosis and treatment. And we support radiation safety and quality assurance. These efforts help respond to the increasing global demand for safe, effective, and sustainable radiology, nuclear medicine, and radiotherapy services. Tackling the burden of cancer requires systematic, equitable, and evidence-based strategies for prevention, for early detection, diagnosis, treatment, and palliative care. We from the IAEA work with partners like the World Health Organization to address this grave challenge in an integrated and holistic way that reflects the One Health approach. Our networks reach across continents and disciplines. Our experts come from all over the world and from a wide range of backgrounds. Even so, cancer often seems one step ahead. To compete, we must scale the good we do, and that means we must innovate. I'm very proud of our work in this area. We innovate in many places. They can be split into three main areas. We innovate in figuring out where our help is most needed. We innovate in using limited resources so they make the greatest possible impact. And we innovate in improving the treatment patients grieve. We collect and map data of healthcare professionals and equipment across communities, countries, regions, and continents to determine where the help is most needed. In all we do, we work in close partnership with the member states who actually request our services. Today, the IAEA has more than 150 projects in nuclear medicine and diagnostic imaging underway in 120 countries. We use innovative cost-benefit analysis in making decisions about supplying equipment and long-term training. For example, benefits don't only come in life saves and lives extended. We can also look at the emotional, for example, the social, the economic benefits of beating cancer. We apply clinical research to understand what factors make a health project successful and how to increase the chance our projects will have the impact we want. At the moment, we are looking at whether centers of excellence could best support communities across regions. I think of them as suns whose rays spread life-giving energy all around them. For example, a nurse or a radiation oncologist looking to train at one of our future regional hubs in Africa would learn the latest techniques in their field. They would also learn how to set up successful training programs in their own communities. Our oncologist and nurse should not be working alone to care for her patient. In cases of cancer, a patient's outcome benefits from the knowledge, the experience, and research of many different professionals. You know it very well. Others include pathologists, surgeons, and radiologists. But what happens when you don't have all these people to rely on, which is often the case in poor areas of the world? One of many IAEA tools that our radiation oncologist can access is a virtual tumor board we call AfroNet. Through the power of telemedicine and the IAEA's extraordinary global network of cancer professionals, her case can be reviewed by a radiation biologist, say in Singapore, a pathologist in Cape Town, a nuclear medicine physician in Vienna, and a surgical oncologist in Bristol. The IAEA is uniquely placed to innovate in radiation medicine. Our clinical trials reach across areas of expertise and across borders. Our open databases offer insights that are not available anywhere else. We are considering the use of radiotherapy as a potential tool to increase the immune system's response to a tumor. Our breakthroughs in these areas benefit everyone, including the poorer countries we assist. As you know, the medical benefits of nuclear technology and techniques go beyond cancer. And so does the work of the IAEA. That means advances in one area of our research can benefit other areas. For example, in 2020, last year, WHO Iaea working group developed technical specifications for ultrasound, X-ray, and CT units, which are the three imaging modalities key to caring for COVID-19 patients. These three modalities are also vital in cancer care, and so our new specifications will benefit cancer patients as well. During the pandemic, offering cancer care became far more difficult. The IAEA did not stop for a single minute. Our impact reviews continued to help member states identify their needs and how to meet them. Our teams helped member states to adapt as they themselves were adapting to the new reality. By putting webinars, conferences, meetings, publications, and training sessions online, we managed to reach even more people than during a normal year. Long before COVID made things more difficult, poor nutrition was already posing a serious challenge to cancer care in many of our member states. Most of the cases go undetected, worsening clinical outcomes. The IAEA is helping doctors to assess a patient's body composition and bone density. Meanwhile, we are researching the relationships between pediatric cancer, nutrition, and clinical outcomes so that we can improve the survival of young cancer patients living in poorer communities. From the malnourished child who, despite his weak immune system, overcomes kidney cancer, to the HIV-positive mother who beats the odds and survives cervical cancer, we know that quality care and radiation medicine saves lives. In fact, we have been able to put a number on it. Thanks to the research the IAEA conducted, together with more than 20 professional organizations, I can tell you that a comprehensive scale-up of combined imaging, treatment, and care quality would prevent almost 10 million deaths worldwide between 2020 and 2030, creating a net economic benefit of more than $2,600 billion. Yes, just like you heard it. What an extraordinary potential social good we are all working towards. It is true, cancer is a formidable foe, but together we are a powerful counterforce.
And our thanks go to Director Grossi for that really powerful presentation and, of course, insight as well into the work of the International Atomic Energy Agency.